Hi, I'm Dr. David Barad. I'm a director of assisted reproductive technology and for the research here at CHR. And we want to talk to you a little bit about the issues concerning pregnancy loss, since this is Pregnancy Loss and Infant Loss Awareness Month. And, for anybody who loses a pregnancy, it feels like the rug is swept out from under you. I mean, when you're trying to build a family, as soon as you have that positive pregnancy test, you have this whole sort of idea of who this child is going to be in your head, and maybe you're playing, is it a boy or a girl? But basically, you're thinking about this child, and it becomes real to you, even when it's just a few cells. And that can be true, I guess, even when you're going through IVF and you have an embryo and you're going through an embryo transfer. I had a patient years ago, and we called it, they called it the sort of a fantasy child, the child that occupies your imagination, maybe even before you get pregnant, maybe even when you come to see us and you're trying to conceive. So that child is so real. And then when you lose it, especially if you're somebody who's been trying for years and finally became pregnant, it really, really comes as a blow. A couple of things to bear in mind. For years, people wouldn't share with their friends or family that they were pregnant until maybe they were 8 or maybe beyond the first trimester. But I think that's a mistake. I think that you probably should share with the people who love you, who take care of you, who you go to when things are good, but also who are there to support you when things go wrong, and bring them into the circle of what you're experiencing, even, when you find out you're pregnant, because they're the people you're going to turn to for support if, in fact, something goes wrong. And, too often in these things, it does go wrong. And to blindside them all of a sudden with, hey, Mom, this is what's happening to me, I don't think that's fair. I think you should bring them into the circle, and so you have that support in the beginning. That doesn't mean that you tell the postman and the butcher and the baker and everybody who you know, but you tell those people who are part of your inner circle, who are going to be there, support you when things go well and if they don't go well. I think that's an important thing to remember. The other thing to remember is that pregnancy is a biological phenomenon, and across the board, 15 to 20% of pregnancies don't go well. Across the board, for infertility patients, 1 in 4 will be lost. And although we do many things to try to protect that, it's not unusual for that loss to happen. So, when it happens to you, you feel like there's a dark cloud sitting over your head and you're the only one that this has happened to. But really, it's a common experience. And like many things, if you share with your close friend that this happened to you, lots of times they'll say, well, it happened to me too. And you'll find that you're not alone. There are also support groups online and through Resolve and other organizations where you can talk to people and talk things out. And it's important. It's a loss. It's a kind of a grief. And some people even will, carry out a ritual, plant a tree, plant a plant. If you have a pregnancy loss, a true miscarriage, I've had patients who've done little tattoos just to memorialize that pregnancy. So do things that are important to you, and recognize that, that it's a loss, it's a grief, and treat it like you would any other loss in your life. And recognize that it will not be forever, and that there is, over time, light at the end of the tunnel, that having experienced a loss doesn't mean that you can't achieve a pregnancy. There are certainly things we can do to help ensure that the next one comes out better. And even if it was just a chance probability thing, the chances are better that you'll be successful the next time you achieve a pregnancy than this time. So just remember, you're not alone. We're here to help you, certainly medically, but also to try to provide some support to you as you go through these difficult times. So thank you for your attention, and I hope this has been helpful for you.